right, welcome back. If you've just joined in, you're watching Good Morning Nigeria on the network service of the NTA. And time now for us to talk on primary health care. And we want to look at, of course, the state of those centers. Now, UNICEF reports indicates that Nigeria has overtaken India as the highest contributor to the death of children under 5 years in the world, unfortunately.
And apart from that gloomy infant mortality picture, Nigeria is equally said to have the highest maternal mortality rate globally. And the ugly trend has been attributed by experts to the poor state of our primary health care centers, which really, as they say, is now at a critical stage.
And experts have also indicated that some whooping 2.5 trillion naira is required to fix about 10,000 primary healthcare centers, spread across the country, and that's within the next 10 years. Now, that's quite a tall order and requiring some very serious political will, Kingsley.
No question about that, Claire. And we have seated with us in the studios to discuss the state of primary healthcare centers in Nigeria. Let's welcome Senator Chukwuka Utazi. He is chairman of Senate Committee on Primary Healthcare and Communicable Diseases. Senator Utazi, pleasure to have you with us this morning.
It's my pleasure to be here once more.
Okay. Also here with us in the studios, we would like to welcome Dr. Yusuf Tanko Sununu. He is chairman of the House of Representatives Committee on Healthcare Services. Honorable, pleasure to have you with us this morning.
Thank you very much for inviting me.
And last but not the least, of course, is a familiar face, Dr. Faisal Shuaib, Executive Director and CEO, National Primary Healthcare Development Agency. Dr. Shuaib, delighted to have you with us this morning.
Yeah, good morning, viewers. Thank you for having me.
Okay, so I would like to start this conversation with the legislators who, of course, have a responsibility to oversight, some of these facilities and institutions. And we have two of them here, fortunately, Distinguished Senator Utazi and, of course, Honorable Dr. Tanko Sununu. Distinguished Senator, what can you tell us about the state of our primary healthcare centers? What have you found out?
Well, you see, the state of our primary healthcare centers in the country is not I won't want to say it's not deplorable, but I want to say that things are not working the way we want it to be, because majority of Nigerians reside in the rural areas, and the nearest point of call, as far as their health is concerned, is the primary healthcare centers. And in these primary healthcare centers, we don't have the requisite, qualified personnel to be there for obvious reasons. Most of the doctors and qualified nurses will not want to be in the rural areas because you don't have electricity, you don't have good roads, you don't have good accommodation, you don't have schools for their children to attend. All these things bedevil the quality of primary healthcare in the places. Added to that is that the buildings, the infrastructure there, you have deficit infrastructure-wise. And then you don't have the materials, with which to work, in those places. So with the result that you cannot expect Nigerians to access healthcare in those areas and they remain healthy. So the problems are there. Because if you have the problems from the rural areas, because the primary healthcare center is the first point of call. From there, if you have complications, you go to secondary healthcare and then tertiary. But this place, you don't have anything to work with. And that is why we are now canvassing this issue, that the government of the Federation, following the budget speech of Mr. President, the 2021 budget speech, he made, the policy direction has been laid. And that's what we are working on. This policy direction he's given in the 2021 budget speech is what all of us involved in the primary healthcare issue in the country are pursuing.
Okay, let's hold there and bring in the honourable member, Dr. Sununu. Infant and maternal mortality deaths, going higher than even in India. That is very sad. And that's irrespective of the gains we made during the MDGs and even the SDGs. We have the SDGs now, which of course has specific goals to cut back on infant and maternal deaths, by 2030. But we'll seem to have, lost, not made much progress in that. Is this a Is it a matter of policy somersault? Is it a matter of policy gap? Or, basically that of poor infrastructure?
Well, thank you very much. Let me just say the issue of rising maternal mortality and infant mortality that today we are counted above India is multifactorial. It could be infrastructural policy and a lot of issues. If you look at the infrastructure determines accessibility. Most of when there is, let's take for example, maternal mortality. The leading cause of maternal mortality is obstetric hemorrhage. And you have only 4 hours within which to act before you can save a life of a woman bleeding. If you look at it now, you realize that most of the villages have no access to such infrastructure that they can go and get treated within 4 hours. And that made it distinct. Apart from that, there is also a policy somersault. We move from one policy to another without really putting much effort to this thing. If you look at the concept of primary health care that came even from 1978, what is the concept? It's to make health care through a scientific and socially acceptable method and practical to the people so that they can do it at minimal cost that they can be able to maintain at any level of time. But if you look at where we are now, the access is not universal. The National Health Insurance Scheme is also not in any way providing a better opportunity for services to be accessible to this thing. And that brought us here that there is need for us to change our policy framework. We are reviewing the National Health Insurance Scheme so that it can cover a wider period that will help in covering the gap. We are also looking at revamping and revitalizing the primary health centers so that they can be effective to render services as closer to the people as possible. And this is the issue. Here we must look at, as said by Senator Otazi, we must look at infrastructure, resources for health, also the budget funding in terms of this thing. And when you look at the funding, let's assume, at least if you want to have an effective primary health center that can provide those services, you need to put infrastructure-wise, you need to please at least put 82 to 100 million to have a system that can function effectively. And not only that, you must give it a very strong backing in terms of personnel resources for health. You need a doctor there that can work on it. You need midwife. You need a lot of services that can do. And that's another huge sum of money. So we now thought that, look, this concept of making healthcare available, affordable, and qualitative to the generality of society cannot easily be achieved by government alone. So we have, as a matter of fact, the legislature and the executive, we came up to conclusion the only way we can is to come and advocate further so that we can also look at both international, national sources of funding so that we can come together, merge resources, move forward, and that concept has also been proceeded before now with the primary health care under one roof. That tried to bring, it's another policy, that tried to bring both the federal government and the state primary health centers and the local government so that we can come together under one roof. We have the same policy, we have the same guidance, and also we must commend the National Assembly for insisting that the National Health Act must also come into operation so that this has now brought additional resources to the primary health centers through basic health care provision fund that will provide both for upgrading of facility and also services so that each and every center must be able to produce at least a basic package that is satisfactory.
Yeah, Honorable Dr. Sonono, thank you very much. Let's bring in Dr. Faisal Shuaib. Dr. Faisal Shuaib, I mean, we've had you on Good Morning Nigeria on a number of occasions. And under the Buhari administration, the immediate past Minister of Health was our guest on Good Morning Nigeria, and he rolled out the federal government's plan for the revitalization of primary health care centers across the country. Where are we on that program before we start saying, all right, this is what we want to do this time?
Right. So since 2015, when President Buhari came into power, it was very clear that his vision was around strengthening the health sector by making sure that we have a solid foundation. That foundation of the health sector is primary health care. And this is why the revitalization of primary health care centers was enunciated as a policy. What we have seen, though, is that there has been some progress in terms of revitalizing some primary health care centers. But in a lot of places, what has happened is not necessarily revitalization in the true sense of the vision and the aspirations of the federal government. What we've seen is that in some states, for example, people will renovate health facilities, and they call that revitalization. So what we're doing as a government, in collaboration with the legislature, is to say we have to go back to the drawing board and make sure that when we talk about revitalization, we're talking about the infrastructure being okay. So yes, you have to renovate, but at the same time, there has to be critical elements such as the utilities, right? You have water, you have electricity, but most importantly, that you have the human resources, the workforce that will deliver the service. Now, in a number of states, you'll go to primary healthcare centers that may have the right infrastructure, but the human resources are not there. What we've now sat together as a Federal Ministry of Health, MPHCDA, and the legislature, what we've also now done is say, what exactly will it take for us to deliver basic health services for all Nigerians between now and 2010, so that we can actually achieve universal health coverage and make sure that, unlike the past when we did not achieve the Millennium Development Goals, that this time around we actually achieve the Sustainable Development Goals that are specific.
We made
specific to the health sector.
Significant progress under the MDGs.
Yes, we did make significant progress, but a lot of other smaller countries actually achieved. We cannot, as a great country with such blessed human resources, continue patting ourselves on the back with just progress. We need to hit the mark. What Mr. President has said, even in his speech, is that we have to strengthen primary healthcare. So in strengthening primary healthcare, we're trying to galvanize all critical stakeholders to say, what is it going to take for us to strengthen primary healthcare, so that by 2030, we're not again having another Good Morning Nigeria session talking about how we're going to strengthen primary healthcare. We want to deliver, we want to meet the aspirations of all Nigerians, and that is why we're talking about how much will it take. We've done an assessment and say, yes, while it is very critical for us to manage the resources efficiently, transparently, and in an accountable manner, what is the gap that is required, and how do we bring in the private sector, like we've seen with Ebola, with COVID-19 outbreak response? How do we bring in our donors, with government leading in front, and they say, yes, if this is what government wants to do, then we will follow government. So all of these conversations are around how we're going to make sure that in the next few years, at least in every ward, you have one functional primary healthcare center that has all the resources to manage basic health services.
How much institutional memory is being sourced for this new push for a revitalized primary healthcare system? I'm asking this question because it is generally acknowledged that when Professor Olukoya Ransom Kuti was Minister of Health, even though under a military regime, he made primary healthcare the focal point of the regime's healthcare drive. And it was to a large extent successful. So what worked at that time that is failing now, or that needs to be further ramped up, if you like, so that we can achieve the critical mass needed for primary healthcare? Any of the guests can take the question.
Kingsley, you are absolutely spot on. What we have done as a Federal Minister of Health is look back to when we were successful, right? In terms of programming, right, we've eradicated the white polio viruses, great. We've eradicated Ebola very well. We're at the point where we've improved routine immunization to levels that are comparable only to when Professor Olukoya Ransom Kuti was a minister. We've looked at what it took, what were the building blocks. Those building blocks are what we're all putting together now. Very, very critical to this is finance. The finance requires that we actually make provision for the funding that will actually not only be for maintenance. So we want to congratulate President Muhammadu Buhari and the National Assembly for making sure that we have the Basic Healthcare Provision Fund. But the Basic Healthcare Provision Fund is largely to maintain, right? It's going to be good for us to maintain our primary healthcare centers. But at this point, we need much more than maintenance, right? Even working with the National Health Insurance Scheme, right? We need to bring our primary healthcare centers to a level where they at least will be at ground zero.
Okay, because sometimes we talk only in monetary terms. what is needed. You have told us we need about 2.5 trillion naira to fix 10,000 primary healthcare centers. Now, for the purposes of M&E, and to also hold you accountable, so that Nigerians will hold you accountable, do you have a data of the needs, to be done over this period of time?
Absolutely. So I'll tell you. So we did the assessment, and what is required is about 2.5 trillion. But by the time you put in all the resources, including the Basic Healthcare Provision Fund, what the states are contributing, what our donors and our development partners are contributing, that gap is now just about 1 trillion, right? With 1 trillion naira over the course of 10 years, right, we'll not only be able to fix the supply issues, right, in terms of the health facilities, right, but also the demand issues. You may recall that in 2018, President Muhammadu Buhari launched the CHIPS program, the Community Health Influencers Promoters Services, right? That is supposed to link up the communities with the health centers. It's not just a question of building a fine health center. It's also where people go to those health centers. So we're marrying all of that, absolutely. We're marrying all of that to have now a robust and comprehensive primary healthcare system.
One question we've always asked, and that's Dr. Faisal, I'm going to put a question to this Senator and Honorable. Senator, you ticked off some of the critical issues that we have with our primary healthcare center: infrastructure, utilities, and personnel. Look, is the federal government going to have to construct roads in the rural areas? Even though you have Ministry of Agriculture and Rural Development, what role do you expect of the subnational entities? Because primary health care centers are also in urban areas. And are they on the same page with you on this? So that Dr. Faisal can make all his arrangements, make all his plans, you can provide all the funding and oversight, and then going forward, you will find that after a while, the thing, as one honorable member said, the thing will just be doing like this, like this, like this.
Well, you see, at the heart of all these issues is a synergy, amongst the different levels of government. And it is our expectation, each time the federal government gives its budget, all the state governments also tailor their budgets towards after what the federal government has done in terms of rural development. If you look at the Ministry of Agriculture and Rural Development, you see what they're doing. You see what RAMP is doing in states. Federal government working with the World Bank, to get things done for our people. If the state governments key into what the federal government are already doing, I think there will be meaningful development in that area in terms of putting the infrastructure. You see, we also expect, the federal government will not do everything. They come in to bring in the critical influence in whatever thing is being done at the local government area in the states. So it's the duty of the states to, to key in, provide electricity. The federal government is also involved in electricity. To put the roads, the rural development agency in the Federal Ministry of Agriculture is also involved in that through RAMP. To bring to make sure that there is infrastructure. That's what we are looking for here now. That the federal government will want to bring money. So this money we are looking for, which we want in this federal budget, is going to complement whatever thing the state government is doing. So that at least in at least 10,000 health centers in the country, you will have one functional in every ward. That can work, that have everything that you need to get things done.
An honorable member, fine, you set up all these healthcare centers, they are all primary healthcare centers, they are working. Maintenance.
Yes, I think I will agree with you. That's why we got it wrong in Nigeria. We have a poor maintenance culture. But the plan and design is to be in such a way that there is continuity in services and maintenance. How do I say that? If you look at what we had before was a lot of policy somersault. You've said that we got it wrong because if we look at even our budgetary allocation to healthcare, which even here in Abuja, it was signed that at least it should be 15% of the total budget of the country.
Dr.
Be allocated
Sununu,
to health.
I'm afraid I have to stop you.
Okay.
Yes, we are almost eating into 9 o'clock, but we do appreciate you, Dr. Yusuf Tanku Sununu, member representing Ngaski Shanga Yauri Federal Constituency of Kebbi State, and Chairman House Committee on Healthcare Services. Thank you very much for joining us. And distinguished Senator Chukwuka Otazi, Chairman, Senate Committee on Primary Healthcare and Communicable Diseases. Always a pleasure to have you here with us.
Thank you.
Thank you. Dr. Feza Shuaibu, Executive Director, CEO, National Primary Healthcare Development Agency, NPHCDA. Of course, with the both representatives here, I have no doubt that you have a robust legislative backing. Right.
All right, so that does it for us today. It's been a crowded day, as it were, in terms of conversation, but we hope you enjoyed it. We're back tomorrow, same time, 7 in the morning. Until then, have a nice day. I'm Kingsley Osadolo.
I am Claire Dilabo Abdurazu. Don't forget to wear a mask, observe physical distancing, and stay safe. Also, stand against rape and rapists.